Now I'd like to recognize the Ranking Member, Ms. DeGette, for opening statement.
Thank you very much, Mr. Chairman, and welcome to you, Mr. Cohen. Thanks to the Affordable Care Act, tens of millions of Americans who would otherwise be uninsured will receive health insurance for the first time. Americans will enjoy protections from the worst abuses of the insurance industry: rescissions, coverage denials, and annual and lifetime limits that cruelly cut off coverage for folks when it's needed most. These are all big changes, and the time to implement them is coming up very, very fast. In just over 5 months, citizens will be able to sign up for health insurance through the federal or state marketplaces. Now, while signing up for coverage should be easy come October, implementation is going to be a complicated process over these next few months, not because of any flaws in the law, but because this is a new approach to providing coverage nationwide, and these things are always difficult to implement. And by the way, the CBO has predicted that overall consumer costs will go down once these marketplaces are implemented. There's no reason to think it won't work. It worked great in Massachusetts under Mitt Romney. But we have to educate millions of people about the marketplaces in advance. SCIO and the states have set up complex data systems to manage the process. So, Mr. Chairman, I'm super glad that you're doing this oversight. And I think we need to hear from Mr. Cohen, probably not just today, but as we go through the summer, about how SCIO is doing, where there are challenges, and how the agency expects to address those challenges. I do think, though, that we should conduct this oversight with an appropriate perspective. I wish, for example, that when the naysayers raise the specter of a potential increase in premiums for some young, healthy people, particularly young men, that they could also put this into perspective by understanding that the tax credits and caps on out-of-pocket costs will sharply lower overall costs for these individuals and millions of other Americans. And I wish that folks raising the specter of high premiums for young men in particular could add to that perspective the millions of women of all ages who will pay lower premiums and who won't be discriminated against insurers simply because they're female, or the millions of Americans who will receive dramatically better and more dependable insurance coverage. When people complain about the fact that the Obama administration is, heaven forbid, spending money to make sure that citizens understand the new law, I wish they would take the perspective to remember that the Bush administration did the same thing, even hiring blimps to spread the word about Medicare and spending $300 million on a public relations campaign for Medicare Part D. And, Mr. Chairman, I will say I voted against the Medicare Part D bill because it didn't allow negotiation by the Secretary of HHS to lower prescription drug costs. But even though I voted against it, I had town hall meetings all throughout my district, and I had internet training to help my constituents figure out how to sign up for it. And I think we need to have that kind of bipartisan cooperation as we implement these exchanges at the national and state level. And so I hope that we take that appropriate perspective, and I hope that we can develop that perspective as the Affordable Care Act is implemented over the coming months. In January 2006, when we implemented the Medicare Part D program, Time magazine described the, quote, initial nightmares of implementation, noting snafus that have resulted in many low-income seniors being turned away by the compounding new prescription drug program. In Vermont, the implementation of the law was described as a, quote, public health emergency. Now, those problems are almost forgotten until today. Ultimately, the Part D program got off the ground, and even those who initially voted against the bill, like me, took a stake in it and worked to fix the problems. The biggest problem, the donut hole, was eliminated by the Affordable Care Act. So I think, Mr. Chairman, as usual, there's a lesson to be learned in this history. I hope that the implementation of the Affordable Care Act goes smoothly. I certainly hope it goes more smoothly than the implementation of the Medicare Part D. But I'm not naive enough, and no one should be, to think it will be completely wrinkle-free. What I do hope is as problems arise, we can work together to identify and fix them instead of using them to simply score political points, because we all have a stake in providing quality, affordable health insurance coverage for all Americans. I hope this hearing and our future work on this subject represents an effort by everybody to truly work together to implement this law. I thank you for having the hearing, and I yield back.